Hey everybody, Dr. Anita here, Milan Family Chiropractic Center. We're going to talk about what does conservative care mean. So I got a medical record on a new patient that's coming in from the orthopedist. And the orthopedist documented, tried conservative care and had MRI done and then went ahead and did epidural injections and continued to write the next report for the second injection to say continuing conservative care. So I want to talk about what is conservative care. Is conservative care drug therapy? Well, I don't think so. Every drug has a side effect. I don't care what it is or what it's for. There are always side effects to drug therapy. So is that really conservative? Physical therapy. Is that conservative care? Yes. Physical therapy is conservative care because you're not putting anything into the body, causing the body to have to react to it. You're working with the body to help the body go through whatever it needs to do in order to help the healing process. Conservative care is chiropractic conservative care. Absolutely. So the reason why I bring this up is when an orthopedist says they've tried conservative care and then they opt for epidural injections without considering chiropractic care, have they done their due diligence and done everything that needs to be done conservatively before they start injecting steroids into somebody's spine? No. The answer is an absolute definitive no. You cannot say that you're doing conservative care if you have not at least considered trying chiropractic care, the most conservative treatment out there. Yes, physical therapy fits that as well. Physical therapy is going to adjust the muscles. Chiropractic care is going to address the joint and the nervous system. Why is there such a distinction between the two professions? Because we need physical therapy to rehab after surgical intervention or after major trauma, sprains, strains, things like that, right? We need chiropractic care to realign that spine, to remove interference to that nervous system so that your body's energy can flow to every tissue, gland, and cell so that your body is better able to adapt and heal. All the stretching and moves that a therapist can do along with whatever they do, electric stim, laser, all of that stuff, is palliative in nature. Palliative meaning it will help symptomatology and help some of the muscle issue. But what does the muscle attach to? The muscle attaches to bone. If you don't address the position of the bone, that nerve is going to be impinged upon, and whatever's attached at the end of that nerve is not going to be able to work the way it's designed to. So conservative care is physical therapy. But most importantly, it must include chiropractic care. That is the best option for conservative care before you have to resort to drug therapy. Conservative care in the orthopedic's mind is, well, we gave you muscle relaxants, we gave you painkillers, we gave you an anti-inflammatory orally, and now we're going to go ahead and inject an anti-inflammatory, a corticosteroid, into your spine. Well, I don't want anybody injecting anything into my spine, never mind putting all that stuff into my body to create side effects. There are tons of side effects. So what if the orthopedic profession actually understood conservative means chiropractic care before you consider drug therapy and steroids? I'm not saying that there's no place for those things, because there are. I just referred somebody to a neurosurgeon this week because conservative treatment wasn't effective. Saw an orthopedic surgeon, had orthopedic surgery, and still has problems. Guess what? Whatever the surgeon did was not enough, and there's a big difference between an orthopedic surgeon and a neurosurgeon, because the neurosurgeon's going to look at the cord, the spinal cord, not just the bones around the nerve root, which is the majority of the case of why people have symptomatology, specifically in their lower back, but again, also in the neck. So conservative was utilized as best we could, and it was time to recognize that we need another opinion. Does it mean this gentleman has to go and have neurosurgery? No. What it means is we want the expert of spinal cords to look at his spine to see if there's any way to decompress the degenerative discs that are going on in his spine. And if there is, that's the expert that we want to talk to, because the orthopedic just doesn't have that skill set like the neurosurgeon. I'm not saying that there's no room for the orthopedic surgeon. There most definitely is. So we're talking about conservative treatment. What is it? It's not drug therapy. That's not conservative. Conservative treatment is chiropractic and physical therapy. That is conservative treatment. Drug therapy is invasive and creates side effects. Epidurals is invasive and creates side effects. And worst case scenario, they can hit the wrong spot and light up your nerve instead of decreasing the pain along your nerve. So this is Dr. Anita from Mylan Family Chiropractic Center right here in Bayville, New Jersey, talking to you about what is conservative treatment. If you considered seeing an orthopedic before you saw a chiropractor, please reconsider. Try a quality, competent chiropractor who's going to do corrective care, not palliative care, not Band-Aid, make you feel better for a minute, but actually correct, if possible, why you're feeling the way you do in a negative way. And if that can be done, you don't have to take drugs for palliative care, and you most certainly don't have to be referred for an orthopedic to do epidural injections, and the end result, if that doesn't work, surgical intervention. And I'm not saying that that's not appropriate at times, because it is. All right? So if you're suffering or a loved one is suffering and you live near Bayville, New Jersey, you need to see me, because I do corrective chiropractic care. It is the most conservative form of treatment for spinal conditions. No matter what your spinal condition is, at least let's get an opinion. I hope you have a fabulous day, and I hope that this gave you some insight on what conservative care really is about. Have a great day. See you on the next ride.